If you don't have control over your reproductive health care, you don't have equality. Contraception is more than just medical care. In addition to birth control, contraception has a lot of uses. It's very useful for prevention of cancer. Women who are on birth control pills have a lower incidence of endometrial cancer and cancer of the ovary. It can also treat acne and premenstrual syndrome. So there are a variety of uses.
Endometriosis is when the tissue that's similar to the tissue inside of the uterus grows outside of the uterus. It's a very painful condition. I started experiencing symptoms probably when I was 13 or 14 years old. I didn't see my friends writhing back and forth every month when they were on their period or laying on their bathroom floors, but I was taught that it was normal by my doctors and my family. It's a surgical procedure to remove the disease. But the problem with it is that not a lot of people have access to that surgery. Birth control is definitely a first line of defense in helping reduce the pain and, kind of slow things down.
A really important issue that's often neglected in this conversation is contraception is cost effective for governments. Every dollar that's invested publicly in family planning services saves us $3 to $4. And for health insurers, it's actually cheaper for them to provide contraception than it is to provide all of the other medical care that happens when contraception isn't available. These decisions aren't based in finances. They're not based in a good medicine. What they're based in is control and weaponizing bodies.
I'm saddened because people are going to be losing access to that care that they need. If they cannot access birth control any longer, then they are going to go back to debilitating pain, which then equals to loss of work, loss of, quality of life. For the people who are using birth control to manage the pain on a day-to-day basis, and it was covered and now it's no longer going to be covered and they may not be able to afford it or access it, it will have a significant effect on their quality of life.
It also opens the door for denial of other services based on, religious beliefs. So are we going to see this, if, for example, insurers deciding they don't want to pay for pre-exposure prophylaxis, for HIV prevention, or trans healthcare, and care for anyone who doesn't conform to your narrow view of the world. So I think that there's a lot of concern that this could, open the floodgate.